Endometriosis is difficult to understand. From a woman's perspective, it is shrouded in myths, taboos, missed diagnosis and hit and miss treatments, particularly from GPs. These individuals have their physical and mental well-being and their social life impacted by this condition, in some cases interfering with their ability to go to school, have an education, get involved in a career of their choice, affecting their social activities, some of their relationships, and it can really interfere with their lives. Access to timely diagnosis and proper treatment for these individuals should not be impacted by the myths that abound about this condition, and so for this reason I'm going to be debunking some of the myths in this series. Myth 1, it's just a heavy period. Women with endometriosis are sometimes just dismissed or made to feel that they are overreacting to normal menstruation. It's just part of being a woman. If they have very painful periods, they are told to just take some painkillers and get on with it. But in fact, what might be happening could be something much more sinister. One theory is that there are cells like the lining of the endometrium or the uterus, but they continue to respond to hormone signals when they are outside of the uterus. Therefore, the cells continue to react, they bleed, and they can cause some inflammation and even scarring depending on where those cells are located. The result is pain, often in line with their menstrual cycle, but sometimes outside of their menstrual cycle as well, because if the scar tissue has occurred, then that can cause pain at any time of the month, and frequently with sexual activity. Endometriosis only affects the pelvic region. Indeed, the most common location for endometriosis-like deposits is in the pelvis, often around the uterus, the fallopian tubes and the ovaries. But endometriosis-like deposits have been found in distant parts of the body, including the lungs and even the brain. Endometriosis always causes pain. Not everyone with endometriosis experiences pain, and sometimes it's only diagnosed when a woman is investigated for infertility. Myth 4, endometriosis can be prevented. We don't know what causes endometriosis, and therefore we don't know how to prevent it. We do have treatments available, and certainly the first line is usually hormonal, which works by reducing the activity of the endometriosis deposits and causing reduced inflammation and therefore scarring. Like many conditions, endometriosis can be helped by having a healthy lifestyle, and one thought is that if you can reduce your own estrogen levels by maintaining a normal weight, that is one of the important factors to take on board. So if you are not a normal weight, then you should consider losing weight and taking more exercise. Endometriosis always improves after menopause. Although endometriosis symptoms often act in cycle with your menstruation, it doesn't always happen like that, and even after menopause the ovaries can continue to produce small quantities of estrogen, and the scarring which has already occurred as a result of the endometriosis previously continues to be a problem. Teenagers are too young to have endometriosis. Although it's common for women to be diagnosed in their 20s and 30s with endometriosis, it's not unusual for these women to have been having seriously debilitating periods since they were a young girl, right from menstruation beginning. And there have been instances where even prepubescent girls have been diagnosed with endometriosis. Pregnancy is a cure for endometriosis. This is a really common misconception. Although sometimes women notice a reduction in their symptoms, pregnancy is not a cure for endometriosis. If you have endometriosis, you can't have a baby. Having endometriosis does not mean that you are infertile. In fact, the majority of women who have endometriosis will be able to fall pregnant naturally. That being said, if you have been trying for more than 6 months and you have a history of endometriosis, you need to start that conversation with your doctor sooner rather than later. The more pain you have, the more endometriosis you have. The severity of endometriosis and the symptoms differs from woman to woman, and it doesn't depend on the amount of endometriosis you have. Period pain is normal, it's just part of being a woman. While women who are menstruating can experience certain normal cramping-like sensations, pain which stops you from doing your normal activities and that doesn't respond to over-the-counter medications is not normal. Sometimes this pain can be in cycle with menstruation, but sometimes the pain can occur outside of the menstrual cycle as well. Hormonal treatments can cure endometriosis. Unfortunately, there is no wonder cure for endometriosis. We do have treatments available, and some of them do use hormones, and sometimes in extreme cases surgery can be helpful. But unfortunately there's no wonder pill or silver bullet to cure endometriosis. Myth 12. Endometriosis is a sexually transmitted infection. Hard to believe that this myth is still going around, so let's shut it down right now. Endometriosis is not a sexually transmitted infection, and it cannot be transmitted sexually. Surgery for endometriosis will leave massive scars. Surgery is often a really important option for women who have severe endometriosis and internal scarring, but it's usually done using laparoscopy or keyhole surgery, and the skills required for this are very advanced, and they often just require tiny little incisions to be made in the surface of the abdomen, often just below your bikini line. It's minimally invasive, and this means a faster recovery time and very little scarring on the outside. Myth 14. It's all in your head, or you've got a low pain threshold. Endometriosis is a real condition. It has physiological origins, and it is not caused by being emotional. Endometriosis is a condition with a very complex etiology. It has deep-rooted, complex hereditary, epigenetic and molecular underpinnings. It's truly a multifactorial physiological disease. Women with endometriosis are often undiagnosed for years, and this can cause emotional issues dealing with the chronic pain and infertility issues that often come with endometriosis. But the chronic pain, which causes the emotional response to endometriosis, is the result rather than the cause of the condition. Myth 15. Hysterectomy can cure endometriosis. Endometriosis is defined as endometrial-like tissue outside of the uterus. So you can remove the uterus, but if the endometrial deposits have already occurred outside of the uterus, then you won't be able to cure the endometriosis. Abortion can cause endometriosis. There is no scientific evidence which links abortion with endometriosis. Those who claim otherwise may be confusing endometriosis with endometritis. And endometritis is a condition that some women can get after abortion or after childbirth, which is where there is a mild inflammation of the lining of the uterus. Endometritis is not the same as endometriosis. Endometriosis only affects women 1 to 2 days a month. Endometriosis is an inflammatory condition, and it can affect women in different ways. Sometimes women get symptoms in rhythm with their menstrual cycle, and other times women can get pain at any other time of the month as well, depending on where the endometriosis is located. As well as in the lower abdomen, women can frequently experience pain in other parts of their body, including the lower back, down into their legs, and frequently during sex. But pain isn't the only symptom that women can experience. They can have bloating, bladder, bowel symptoms, and these can affect personal and social relationships, as well as interfering with the ability to study or work. The costs of managing the condition can have a large financial impact, as well as a large impact on her well-being, both physically and psychologically. One study by Monash University found a strong link between endometriosis and feelings of depression and anxiety. So it's important that if you feel depressed or anxious, that we address those symptoms in addition to your overall management of the endometriosis. 18. Endometriosis can be easily diagnosed. Many women feel that their symptoms aren't severe enough to seek medical attention, or when they do, they can be so varied that doctors can find it difficult to make sense of them. And on average, it takes over 10 years for a woman with endometriosis to be diagnosed. If you see a doctor and you feel that your concerns are not being met, see another one for a second opinion. 19. Tampons cause endometriosis. Clear where this myth came from, but it may be related to the concept of retrograde menstruation, which is the idea that menstrual blood can track backwards instead of out through the vagina. It tracks back up through the fallopian tubes and into the peritoneum. But there's no evidence to suggest that women who use tampons have a higher incidence of endometriosis. It's about the same. Myth 20. Endometriosis can be diagnosed by a simple examination. Unfortunately, endometriosis is notoriously difficult to diagnose, and this is one of the reasons why many women have to wait so long to have a diagnosis, because the gold standard for diagnosing endometriosis is a laparoscopy, where you can actually physically see the deposits of endometriosis. But in order to do this, you have to have a laparoscopy and a general anaesthetic, and that's hard to do because it's costly and difficult to access. On the basis of taking a really careful history and examining a woman, a doctor may be able to come to the conclusion that there's a high likelihood that a woman has endometriosis. There are also some very sophisticated ultrasound examinations called deep infiltrating endometriosis type scans. Unfortunately, these are difficult to access in Australia. Myth 21. High estrogen levels cause endometriosis. High estrogen levels have not been shown to cause endometriosis. However, estrogen blocking agents can be used to treat it. Research is ongoing into the role of estrogen in endometriosis, and therefore therapies which could be used are targeting the activity of estrogen receptors on the surface of cells. And in addition, there are some studies looking at the role of immunomodulating drugs in endometriosis. So we've debunked just a few myths around endometriosis. Remember to empower yourself with knowledge from reputable sources, which include your GP, your gynaecologist, and from advocacy groups. Be very careful with some stuff that you see on the internet, particularly when it relates to trying to sell you things. Let me say this again. Severe period pain is not normal. Being in pain is not a normal part of being a woman. And if you're having difficulty getting on with your day, then you need to seek assistance.